I've just received another briefing from a great group of talented people on the virus that is going around to various parts of the world. We have, through some very good early decisions that were actually ridiculed at the beginning, we closed up our borders to flights coming in from certain areas, areas that were hit by the coronavirus and hit pretty hard. And we did it very early. A lot of people thought we shouldn't have done it that early, and we did, and it turned out to be a very good thing. And the number one priority from our standpoint is the health and safety of the American people, and that's the way I viewed it when I made that decision. Because of all we've done, the risk to the American people remains very low. And we have the greatest experts in the world, really in the world, right here. The people that are called upon by other countries when things like this happen. We're ready to adapt, and we're ready to do whatever we have to as the disease spreads, if it spreads. As most of you know, the level that we've had in our country is very low, and those people are getting better, or we think that in almost all cases, the better are getting. We have a total of 15. We took in some from Japan. You heard about that, because they're American citizens and they're in quarantine. And they're getting better too. But we felt we had an obligation to do that. It could have been as many as 42. And we found that it was just an obligation we felt that we had. We could have left them, and that would have been very bad, I think, American people. And they're recovering. Of the 15 people, the original 15, as I call them, 8 of them have returned to their homes, to stay in their homes until fully recovered. 1 is in the hospital, and 5 have fully recovered. And 1 is, we think, in pretty good shape. And it's in between hospital and going home. So we have a total of, 15 people, and they're in a process of recovering, with some already having fully recovered. We started out by looking at certain things. We've been working with the Hill very, very carefully, very strongly, and I think we have very good bipartisan spirit for money. We were asking for $2.5 billion, and we think that's a lot, but the Democrats and I guess Senator Schumer wants us to have much more than that. And normally in life I'd say, we'll take it. We'll take it. If they want to give more, we'll do more. We're going to spend whatever's appropriate. Hopefully we're not going to have to spend so much, because we really think we've done a great job in keeping it down to a minimum. At the same time, you do have some outbreaks in some countries. Italy and various countries are having some difficulty. China, you know about where it started. I spoke with President Xi. We had a great talk. He's working very hard, I have to say. He's working very, very hard. And if you can count on the reports coming out of China, that spread has gone down quite a bit. The infection seems to have gone down over the last 2 days. As opposed to getting larger, it's actually gotten smaller. In one instance where we think it's somewhat reliable, it seems to have gotten quite a bit smaller. I want you to understand something that shocked me when I saw it, that I spoke with Dr. Fauci on this, and I was really amazed, and I think most people are amazed to hear it. The flu in our country kills from 25,000 people to 69,000 people a year. That was shocking to me. And so far, if you look at what we have with the 15 people, and they're recovering, one is pretty sick, but hopefully will recover. But the others are in great shape. But think of that, 25,000 to 69,000. Over the last 10 years, we've lost 360,000. These are people that have died from the flu, from what we call the flu. Hey, did you get your flu shot? And that's something. What we've done is we've stopped non-U.S. citizens from coming into America from China. That was done very early on. we're screening people, and we have been at a very high level, screening people coming into the country from infected areas. We have in quarantine those infected and those at risk. We have a lot of great quarantine facilities. We're rapidly developing a vaccine, and they can speak to you. The professionals can speak to you about that. The vaccine is coming along well, and in speaking to the doctors, we think this is something that we can develop fairly rapidly, a vaccine for the future, and coordinate with the support of our partners. We have great relationships with all of the countries that we're talking about. Some it's a fairly large number of countries. Some it's one person, and many countries have no problem whatsoever. And we'll see what happens. But we're very, very ready for this, for anything, whether it's going to be a breakout of larger proportions or whether or not we're at that very low level. And we want to keep it that way. So we're at the low level. As they get better, we take them off the list so that we're going to be pretty soon at only 5 people. And we could be at just 1 or 2 people over the next short period of time. So we've had very good luck. The Johns Hopkins, I guess it is a highly respected, great place. They did a study, comprehensive, the country's best and worst prepared for an epidemic. And the United States is now, we're rated number 1. We're rated number 1 for being prepared. This is a list of different countries. I don't want to get in your way, especially since you do such a good job. This is a list of the different countries. The United States is rated number 1, most prepared. United Kingdom, Netherlands, Australia, Canada, Thailand, Sweden, Denmark, South Korea, Finland. This is a list of the best rated countries in the world by Johns Hopkins. We're doing something else that's important to me because he's been terrific in many ways, but he's also very good on health care. And we really followed him very closely. A lot of states do. When Mike was governor, Mike Pence of Indiana, they've established great health care. They have a great system there, a system that a lot of the other states have really looked to and changed their systems. They wanted to base it on the Indiana system. He's very good. And I think, and he's really very expert at the field. And what I've done is I'm going to be announcing exactly right now that I'm going to be putting our Vice President, Mike Pence, in charge. And Mike will be working with the professionals, doctors, and everybody else that's working. The team is brilliant. I spent a lot of time with the team over the last couple of weeks, but they're totally brilliant, and we're doing really well. And Mike is going to be in charge, and Mike will report back to me.
As of today, we have 15 cases of COVID-19 that have been detected in the United States, with only 1 new case detected in the last 2 weeks. We also have 3 cases among Americans repatriated from Wuhan and 42 cases among Americans repatriated who had been stuck on the Diamond Princess in Japan. The president's early and decisive actions, including travel restrictions, have succeeded in buying us incredibly valuable time. This has helped us contain the spread of the virus, handle the cases that we have, and prepare for the possibility that we will need to mitigate broader spread of infections within the United States. The president's actions, taken with the strong support of his scientific advisors, have proven to be appropriate, wise, and well calibrated to the situation. We're grateful for the hard work that healthcare workers, first responders, communities, and state and local leaders have put into the response so far. Because of this hard work and the president's leadership, the immediate risk to the American public has been and continues to be low. Our containment strategy has been working. At the same time, what every one of our experts and leaders have been saying for more than a month now remains true. The degree of risk has the potential to change quickly, and we can expect to see more cases in the United States. That is why we've been reminding the American public and our state, local, and private sector partners that they should be aware of what a broader response would look like. CDC has recommended that the American public, and especially state and local governments, businesses, and other organizations, should refresh themselves on how they would respond in the event that the situation worsens. we're encouraging Americans to learn what future steps might be necessary to keep themselves and their communities safe. Knowing these potential steps now can help keep the risk to you and your community low.
Are you telling the Americans, except for the ones who are sick, not to change any of their behaviors?
No, I think you have to always, I do it a lot anyway, as you probably heard. Wash your hands, stay clean. You don't have to necessarily grab every handrail unless you have to. You do certain things that you do when you have the flu. I mean, view this the same as the flu. When somebody sneezes, I try and bail out as much as possible with the sneezing. I had a man come up to me a week ago. I hadn't seen him in a long time, and I said, "How you doing?" He said, "Fine, fine." He hugs me, kisses. I said, "Are you well?" He says, "No." He said, "I have the worst fever and the worst flu," and he's hugging and kissing me. So I said, "Excuse me." I went there, I started washing my hands. So you have to do that. This is, I really think, Doctor, you want to treat this like you treat the flu, right? And, it's going to be fine.